SKMC is really critical to the healthcare provided in Abu Dhabi. It's the largest hospital in the country. It's the major tertiary referral center in the country. We have the only emergency department in Abu Dhabi. We are opening up a new pediatric emergency department, a new adult emergency department, and we are really the only subspecialty center in all of Abu Dhabi. We are part of a larger system, the larger SAHA system, which encompasses other facilities like Corniche Hospital, Mafraq, and Tawam and Al Ain. And SAHA has kind of SAHA-wide initiatives to integrate the system through computer programs, through electronic medical records, integrating radiology and integrating the laboratory. And SKMC is really instrumental in the integration of those services. So really, SKMC is positioned to be the major hospital for all of Abu Dhabi, and it will continue to be so. And we're really working on becoming a center of medical excellence for a variety of specialties. SKMC is a government hospital, and it is owned by SAHA, which is the parent company of SKMC, as well as the other hospitals within the SAHA system. SAHA has contracted out to the Cleveland Clinic to serve as the management company for SKMC. So Cleveland Clinic is responsible for staffing the senior levels of the SKMC staff, so pretty much all of the C-suite, and also responsible for ensuring the smooth operations of the hospital, the budgeting of the hospital, the medical quality and the medical staffing of the hospital. So really what we're trying to do is we're trying to take the Cleveland Clinic system and the Cleveland Clinic programs and replicate them here at SKMC as much as we possibly can. One of the main reasons that SAHA has contracted out with the Cleveland Clinic is to really bring the healthcare standards in Abu Dhabi up to international levels. And we're making very, very good progress on this, as evidenced by our recent JCI certification, where the JCI inspectors said that we scored higher than any other hospital internationally that they had ever inspected. We also have recently gotten CAP certification, which is an internationally recognized certification for our laboratory, which is here in SKMC. And we are the only laboratory in the Middle East that has CAP certification. So really, with the partnership between SAHA and the Cleveland Clinic, we're very actively increasing the medical standards in Abu Dhabi, and we're really achieving international recognition. Like everything else in the UAE, healthcare is changing and evolving very rapidly. So it's really quite difficult to predict where the healthcare environment will be in 3 years or 5 years and 10 years, although I know that the government has a very clear vision of where they're trying to take it. In terms of the current services available, there are some gaps that I see that it would be very helpful if other companies or private investment could come in and fill those gaps. One of the issues that we struggle with at SKMC is our long-term patients. There's really, it's difficult for us to find a place to put them outside of SKMC. And what that does, that causes a congestion in our beds, so we don't get the patient throughput that we would like to see in the hospital. So I think one of the keys for Abu Dhabi, and maybe for the UAE as a whole, is addressing this need for long-term care for patients in a subacute setting or a non-hospital setting. There's also probably significant opportunity in centralized radiological services, centralized laboratory services, physiotherapy, and orthotics and prosthetics. I think from what I've seen as the CEO of SKMC, we would benefit and our patients would benefit from more focus on those services. Running a healthcare facility really in any part of the world is extremely challenging. Healthcare institutions or hospitals have been compared to nuclear submarines in terms of the level of technical expertise that it takes to manage the facility. In addition to that, you have a very complex and diverse staff, and you have very complex and diverse patients and patient needs. So anywhere in the world, running a hospital or a large hospital is a very complex job. This is an additionally challenging environment for a variety of reasons. One is just the sheer rate of change here, the change in the structure of the healthcare delivery system, the change in the regulations, the change in the infrastructure in the country. It adds additional challenges. And recruiting into the Middle East at this point in time is pretty challenging. What we're trying to do is really reach out to a variety of countries and pull the best specialists from those countries into the Middle East. And what a lot of people don't know who haven't been here is how nice Abu Dhabi is, how clean it is, how safe it is, how good the infrastructure is. And so trying to get our recruits to understand that Abu Dhabi is really a very, very nice place to come and a very nice place to live and a nice place to work is one of our big challenges. An additional challenge in running an institution like SKMC is really the sheer number of countries that are represented in SKMC. We have staff from 51 different countries. We have physicians from over 40 different countries. So trying to get all of our clinical staff, our physicians and our nurses, to practice to the same recognized international standard, which may be different from the standard that they practice in their home countries, is really a significant challenge. And we address that challenge really through open communication, through dialogue both ways, and through consistency, and by trying to identify internationally accepted algorithms of care and then institute those algorithms throughout the institution. In addition to that, we have patients from probably 30 different countries, maybe 40 different countries here, and trying to make sure that the messages and the care that we give is culturally appropriate for all of the patients that we see. It's quite a challenge. It's exciting, but it's quite a challenge.